Hi, my name is Nicole Peterson. I teach at the University of Iowa College of Nursing. I'm also practice now currently at the Meskwaki Tribal Health Center 1 day a week. I have done a lot of long-term care in the past. I just love working with older adults. When I transitioned into teaching, I really found I loved the aha moments with students when you can tell that something is clicking and they get it, and you see the look in their eyes and like their face relaxes. That's what I live for when I teach. And since I've had a lot of clinical practice, and I actually really enjoyed teaching patients when I was a staff nurse, which is kind of an interesting thing. So I was not the strongest student ever, and really had a lot of really good faculty who helped me get through a lot of tough things. So when I got into teaching, I really realized, I really like that I can kind of reach the students who are struggling to make the connections. And when I did clinical teaching, when you get a student who says they're really nervous or they're struggling with their core content, and then they have an experience on the floor and they just like, wow, stuff clicks and things start to fall together for them. That's what I really started really loving. And I did clinical teaching as my first actual teaching before I went into teaching didactic. So when I started teaching in the didactic, I was super excited to be able to take over the geriatric lecture content for our undergrad program. I had done several adult gero NP classes by then, some clinical, some lecture, some online, some in person. But to be able to take that class on, I was really, really nervous, because when I was in undergrad, my mentor for that class, she turned out to be my mentor, and she was an amazing person. So I just felt like, looking back, there's no way I could fill their shoes. And the person who I took over the class from also was an amazing person and still is, at the University of Iowa. And I just felt so like I can't ever do what they do. And so when our dean actually sent an invitation for faculty to go through training to do active learning, I said, sure, great, I'll check it out, see what this is all about. And when I went through that, I was a little nervous because I was still new to curriculum design and looking at the theory behind what you're doing. So I was a little nervous when I did it, but actually a few of us who we're now called the early adopters, we really got into how to change the classroom to really make it work for our students. And so nowadays you see students with their laptops. They want everything online. They want it to be easy and accessible. Actually at the conference, there are many people who had their laptops and information was given out on a flash drive. So taking our technology and using it to our ability to keep students engaged, to keep people engaged, to help them manage all of that information coming at them so that they can get the messages they need to get, but also be able to use those messages quickly, is really a challenge. So how do you go about doing that? And so it's really been a challenge for me over the past several years to continually update my class. I also teach, besides the lecture class, I also teach still in the gerontological clinical practicum, so I still get that aspect as well, and then also I practice 1 day a week as well, so I'm still getting that kind of a clinical practice. So to be able to kind of infuse all of these things together, I still also teach sometimes in the simulation center, so I get to do some hands-on stuff with the students in very small groups, which is nice, to have students in all of these different settings for class. And so with the active learning, the thing that I struggled with the most was not so much why we need to do this, why we need to keep students engaged, but how do I actually make that happen? How do I make it successful? And my bosses have always been really supportive through the very, very slow transition. And so throughout this last several years, I was trying to work on this, slowly working on this and bringing in more faculty to help. Kind of, it's been helpful to have the newer people just get all of the tricks and tips right away. The things that, my kind of blood, sweat, and tears and things that I've learned, lessons I've learned along the way, gave you that to begin with so that you're not starting from the beginning. So that's kind of my goal with the presentations that I'm doing, to kind of show you what I did and see if you can use some of that in your settings. And I've used them for small groups and big groups, and sometimes getting pretty creative to try to help students know what they're coming in to learn, be prepared for class, actually get them to read their textbooks. And I know that's still a challenge, and I still struggle with that quite a bit, but have them come to class and be engaged, and to actually let things sink in immediately, and then in the class time actually do something hands-on where they're remembering what they did, they're applying that information right away. They have a case study where they can relate to that, and then they take it back and they use it in their clinical settings, they use it in their other classes. Maybe when they're in their farm class, they think back to something we did with, medication reconciliation with older adults, and then they kind of remember, oh gosh, I remember these side effects we talked about. So taking that information and using it also helps them retain it. And so that's kind of what I've wanted to hopefully accomplish with my presentations. And now that I've done it a few years, I'm starting to see some positive results from my students where they're actually saying, this is really helpful. I look forward to coming class. It makes sense to me. We're tired. We know all nursing students are tired because we did it too. They're tired, and when they come to class, they know that they're going to be using the information right away, and that they usually every day have a takeaway that they can have at the end of class, so that when they stop and think back to what did we do in class yesterday, they can remember what they did in class and then can remember what they learned. And so hopefully they go back and review that, and it's a little bit easier when they get to the exams. So my advice for anybody who's interested or thinking about infusing active learning in their classroom is really to just start it. Start small, do something little by little. One of the biggest things was to make sure that my students were on board, because I would get the, why do we have to do this? And why aren't you doing it the way everybody else is doing it? And can't you just give me the PowerPoint like everybody else? So those are some of the barriers that I had from the students. But once I can get them on board, frequent reminders throughout the semester, this is why we do this. This is why, I want you to do it this way. It's taken me a couple semesters now to kind of get students on board, but now that they are and they know what to expect, they're much happier. So I think one thing that I kind of failed at the beginning was helping them know what the expectation is in this different type of a classroom, and that they will be doing something every day, so that they should prepare so that they're working in their small groups of 3 to 6 people, and they want to be a good teammate. And I always emphasize that nursing is a hands-on team sport. Even if you don't like your teammates, you still have to work together. And so that's one of the things that kind of getting the students to recognize, like, they need to know when they come to class, they're responsible for having to be prepared for their team that they're going to be working with. So good luck.